Hey there, it's Ryan Liberty. In this video, I'm going to answer the question, what is post-traumatic stress disorder, also known as PTSD? Oh, let's find out. Ooh, ah. Alright, let's get to what PTSD, also known as post-traumatic stress disorder, actually is. We'll get to that in a second, but first I just have to say that what I'm talking about here are not diagnostic criteria. This information is just short description. It should not be used to diagnose yourself or someone else. Only a trained professional can do that. So this is just to point you in the direction of something that you may be experiencing in your life, or somebody else may be experiencing that you love. Also, these are just labels, so if post-traumatic stress disorder or PTSD in some way hurts you, if it makes you feel, if you don't like it, in other words, you don't have to use the label. Again, it's just to point you in a certain direction, so don't worry about the label if that bothers you or distresses you or keeps you from healing in any way. So post-traumatic stress disorder has a lot of components, and because of that, I really need my notes today, and you'll see me looking down a lot, but I want to cover as much of it as I possibly can here because it is a very complex disorder. So the first thing to note about post-traumatic stress disorder is that it is a reaction to a trauma that has been experienced, actual or threatened death, serious injury, or sexual violence. This can happen in many different ways. You could actually experience it yourself. You could witness somebody else experiencing it, or it could be something that you have been exposed to over and over again, like in the case of an emergency worker who constantly sees medical injury or death. It can include things like recurrent memories, recurring dreams, dissociative reactions, which are known as flashbacks, intense or prolonged psychological distress towards triggers, and I'll have a video about triggers just to be clear about what those are, and also physiological reactions to triggers, and I'll get to all of this a little bit later in the video. It includes avoidance of reminders of memories, feelings, or thoughts. So what you typically have happening, I'll stop here just to give a little idea of what happens, is somebody experiences something traumatic, and then later on they experience something that reminds them of that traumatic event, and it makes them kind of freak out. They don't necessarily know why they're reacting that way, but there's this intense physiological arousal, this intense emotion, and they'll have an outburst, or they'll just freak out on the moment and not be able to handle it. So that's generally what we're talking about here, and what I just said is that they'll avoid very often these memories or the thoughts or the experiences that trigger these things because they don't want to feel that intense, scary, horrifying emotion that they felt the original time that they experienced the trauma. Now, in addition, we have, again, this is a very complex disorder. There's a lot of stuff going on here. So we have negative thoughts or moods around that traumatic event, including not being able to remember parts of the event, which is known as dissociative amnesia. I'll make a video on that also at some point. Persistent negative beliefs about oneself or the world, persistent distorted thoughts about what happened, and that lead you to blame yourself or somebody else for why it happened. Persistent negative emotional state, diminished interest in significant activities, feeling detached from other people, a persistent inability to experience positive emotions. So generally it's very hard to be happy. There's constantly thoughts running through our head of why things are bad, why you can't trust people, the world is bad, and you may forget parts of what happened. It's very confusing and disorienting. Also, there is changed arousal level since the event, so you may be irritable, have outbursts, reckless or self-destructive behavior, hypervigilance, which I'll make another video for that too. Again, this is a very complex disorder. Hypervigilance is just kind of zeroing in, having extra attention to things that may appear like threats. You'll have an exaggerated startle response. I have a video for that. Poor concentration and sleep disturbance. And this all has to have been going on for more than 1 month since this traumatic event has happened. If it's less than 1 month, it's typically diagnosed as acute stress disorder. So all of this has to result in significant impairment in your daily life or your relationships. It is not something that's caused by drugs or a medical condition, and it can include a feature of depersonalization or derealization. It can be treated, so you have cognitive behavioral therapy, dialectical behavioral therapy, group therapy, cognitive restructuring, stress inoculation training, EMDR, which is eye movement desensitization and reprocessing. In general, you should see somebody who specializes in trauma, who can put together a plan for you, because it is a very sensitive topic. It's a very frightening experience for the people going through it. So having somebody that can care for us and to help collaborate with us to come up with a good plan to tackle everything is a good idea. Something I noticed while looking through the information that I did to prepare for this video was that people who have PTSD, they have an 80% chance of also having another mental disorder in addition to it, which I thought was significant to mention here. So if you find that you're going through all of these different symptoms and maybe they don't explain everything, there may be something else out there going on at the same time. So what does PTSD feel like for the person experiencing it? Well, I listed a number of ways that it shows up as symptoms. I'm going to try to give you the best picture I can here of what it feels like for that person. So first, as far as the way they feel it in their body, there's a high anxiety when they're triggered. So all the symptoms of anxiety show up: sweating, heart racing, having trouble breathing, all those kinds of things. They have, as I mentioned before, there's an exaggerated startle response. There's problems sleeping. You may feel dizzy for prolonged periods of time. You may have blurry vision. So all these kinds of things affect the way that you experience it in your body. You have the cognitive experience, your thoughts here, which is you have those memories that keep showing up over and over again. You have those dreams that you keep having, trouble concentrating. You may find that you forget things. You'll forget a phone number, forget where you put your keys, forget an appointment. Dissociation is a big experience that we have, and I'll make another video on that. But in general, dissociation is kind of that zoning out feeling. You may have suicidal thoughts. Negative thoughts are a big sign of PTSD. So things like, I'm a bad person, my whole body is ruined, my life is over, I can't trust anyone, the world is a dangerous place. And again, some of that blaming can come into play. It's my fault that I was abused. Emotional feelings that we have around PTSD, there could be that depersonalization, derealization. So not feeling like you're attached to yourself or not feeling attached to reality. You may feel fear, horror, anger, rage, guilt, shame, tired. You may have like a low motivation level because you constantly keep experiencing these high anxiety levels, and it kind of leads to a burnout. And the way somebody with PTSD may behave is that they may avoid things that trigger this behavior. They may try to, it's like a coping mechanism to try to avoid the things that we feel are setting off these anxious, intense moments that we go through. That hypervigilance shows up, and outbursts, yelling at people, getting into fights, very strong responses to things that it doesn't really make sense for why you're responding that way. That's because most likely it's a trigger to a traumatic event that's been happening in the past. So if you see somebody who's kind of acting a little erratic maybe, that may be an indication that there's PTSD going on. Before I end the video, I just want to mention that there is a concept called complex PTSD out there. It is not a recognized diagnosis, but the concept helps explain why some of these symptoms here, they explain PTSD, and PTSD again can happen because of a traumatic event like a car crash or child abuse, many different reasons, but complex PTSD specifically hones in on those long-term prolonged traumas, and I will make a video about that and the symptoms are a little bit different, so it may be worth noting and worth checking out. I thank you for taking the time to learn about post-traumatic stress disorder, and I'm glad that you are interested in learning about mental health, so thank you here for joining me in the video. Hey, it's Ryan Liberty. If you like that video, please give it a thumbs up, share with a friend, and leave any questions or comments down below because that would really help me out. If you're somebody who's gone through a traumatic event and you're feeling cut off from the people around you, I have a free course that will help with that, so please click to get it. And if you'd like to see the rest of my videos, please click subscribe. As always, I want to remind you that your life matters. Nobody can question your worth. However it is that you're feeling, whatever it is that you're going through, it's okay, and you are loved. Thanks again for watching.